Thank you very much, Mr. Chairman. And like everybody else on this committee, we all wish Senator Kennedy the very best, and we miss him, and we appreciate all of the work that he's done for so many years, and we all hope, no offense, Senator Dodd, that he's back there.
I want him back.
And I know you're the first that would say that, so that's what we all want. There is some agreement in this committee on something, and I think we could agree on that. Mr. Chairman, I think most Americans understand that our current health care system is disintegrating, and that's the word that I would use. Today, we have about 46 million Americans who have no health insurance, and very importantly, and we don't talk about this enough, we have even more who are underinsured. And the importance there is it's not good enough to say, gee, everybody has insurance. You have to ask, what is the quality of insurance? How meaningful is it? Is it a $10,000 deduction? Is it a $5,000 deduction? Furthermore, in the midst of this disintegrating system, we have some 60 million Americans who do not have access to a doctor on a regular basis because we have a disaster in primary health care. Now, why is that number important? It's important because we have close to 20,000 Americans who die every single year because they don't have access to a doctor, and by the time they get medical care, their treatment is, their problems are so far along, their illnesses are so severe that they die when they should have lived. You know, I know that in the coming weeks and months, we're going to see a lot of TV ads about all of the terrible things that are happening all over the world. I hope some of those people will focus on families that have lost a loved one simply because that person could not get to a doctor because of lack of health care. We lose close to 20,000 people every single year because of a lack of a doctor. That is 3 times what we lost. That's 6 times what we lost on 9/11 every single year, close to 20,000 people. Now, in the midst of all of this, some people will say, okay, you got all these people uninsured, all these people underinsured, all these people are dying because they don't have a doctor, but at least we're not spending a lot of money. You know, when I was a kid, I didn't have any money. I used to buy, a $200 car, used to break down all the time. And you say, well, I only paid $200 for a car that broke down. But that is not the case with health care. The fact of the matter is that today we spend $2.7 trillion on health care, 18% of our GDP, and we spend far, far more than any other country on earth for health care. Today, the average American is spending about $7,900. Can you believe that? $7,900 a piece on health care. And despite that huge outlay, a recent study found that medical problems contributed to 62% of all personal bankruptcies in the year 2007. Personal bankruptcies in the United States, for a variety of reasons, are growing. Close to 1 million Americans will suffer a personal bankruptcy because of medical-related problems. So what you're looking at, I know we throw out a lot of numbers and a lot of concepts. Illness is tough to deal with, isn't it? And if somebody comes down with a serious illness, they're focusing on how they get well. The family is focusing on how they get well. And uniquely, in the industrialized world, our families have to focus not only on how you get somebody well, but the financial consequences of paying off huge bills, and in 1 million families, that leads to bankruptcy and the destruction of families. But it's not only a personal crisis. Our healthcare situation is obviously a macroeconomic crisis. General Motors, and we all know what's happening to General Motors, spends more money on healthcare per automobile than on steel. More on healthcare than on steel. One of the reasons why they are where they are today, along with other auto manufacturers. Small business owners in Vermont and across the country are forced to divert hard-earned profits into health coverage for their employees rather than in new business investments. And because of rising costs, it is no secret that many businesses, small, medium, are unable today to provide any health insurance for their workers. The fact of the matter is that we as a nation today are spending almost twice as much per person on health care as any other country. According to the OECD, in 2006, the United States spent $6,700 on health care, Canada spent $3,600, France spent $3,400, about half of what we spent, and Italy spent $2,600. Now, Mr. Chairman, I'll tell you something. I think it is very easy to criticize other countries' problems, and every country has a problem, no question about it. There is no perfect healthcare system on earth. But I think it would be interesting to bring the leaders of other countries here to tell us how, in fact, in virtually every instance, they are providing universal, comprehensive health care for a fraction of what we are spending. What are they doing that we are not doing? That is a lesson I think we should explore. So, despite all the problems we have, despite all the expense that we have, we should also note that we get poor value for what we, in fact, are spending, according to the World Health Organization. The United States ranks 37th in terms of health systems performance, and we are far behind many other countries in terms of infant mortality, life expectancy, and keeping people from dying when they should not be dying. As the health care debate heats up here in Washington and on this committee, we as a nation, it seems to me, have got to answer two fundamental questions. And there is, I think, disagreement on the first issue. And that is the very simple one. Should every American have health care as a right? Now, that exists in every other industrialized country. Obviously, it doesn't exist in our country. 100 years ago, people at the federal and state level said every kid in America should be able to go to school. So every kid in America can go to a public school today, regardless if the family is rich and poor. No one debates that. Education is a right. When you dial 911, the police department comes to your door, whether you're rich or you're poor. I've not heard anyone suggest, well, you know, you're not paying enough in taxes, police shouldn't come. Fire department shouldn't come when your house is burning. But somehow in health care, if a low-income worker gets very, very sick, well, you're on your own. You're on your own. Uniquely in the industrialized world, that person is not guaranteed health care. So that's an issue we have got to deal with. And I think I am on the side of the vast majority of the American people who say something is wrong, health care should be a right of all people. Not everybody agrees with that. I think a majority do. If we agree with that, then the second logical question is pretty simple. And that is, how do you provide health care, comprehensive health care, to every man, woman, and child in a cost-effective way? Because you can provide health care to everybody, and as others have said, you can destroy the Treasury. You can bankrupt the country. A lot of ways you could do it. But the challenge we face is how do we do it in a cost-effective way? Now, let me raise a question that has not yet been raised, or make a point that has not yet been made. And I find it amazing that somehow we have forgotten to talk about this issue. And that is, it seems to me, if we are serious about providing health care to all people in a cost-effective way, somebody has got to say, what makes our country different from every other country on earth? What's the difference? And there is a difference. The difference is that our system is dominated by private health insurance companies. And I hope I will not shock anybody on this committee or anybody in this country by suggesting what everybody knows to be true. The function of a private health insurance company is not to provide health care. The function of a private health insurance company is to make as much money as possible. And quite often, the way you make money as a private health insurance company is to deny health care. Every dollar that I deny in health insurance, every pre-existing condition, every time I terminate somebody's health insurance because they were really sick last year and they really need it, is a dollar more I make. It is no secret that private health insurance companies hire people to find out who was sick last year, go over the records to make sure that we don't continue that policy. I think that's basically insane. I think that's immoral, but that is obviously endemic within our system. And the other issue that we don't ask, apparently we're not allowed to talk about in terms of the role of the private health insurance industry, is that they are responsible for giving us the most costly, wasteful, complicated, and bureaucratic system in the world. I just talked yesterday. Guy in my office, he is an attorney, very smart guy. His wife has a PhD. They sat down to go over the federal employee benefits program that we have. They couldn't figure it out. PhD and a lawyer. There are people who are bombarded with hundreds of different types of programs. We have 1,300 private health insurance companies that provide thousands of different programs. And they're different if you're young, they're different if you're old, they're different if you're sick, they're different if you run the marathon. You got all of these things. And here's the point. Some people tout this, oh, look at all the choices you have. Well, people are not choosing health insurance companies. They're choosing doctors, they're choosing hospitals, not health insurance companies. When you have thousands of different programs, you have a complicated, bureaucratic, wasteful system. And here's the fact that we should all appreciate. At a time in America today, and there should not be any difference of opinion on this, we are in desperate need of primary health care doctors. We are in desperate need of dentists. We are in desperate need of other medical personnel. You'll all be happy to know that the number of administrative personnel in this country over the last 3 decades has grown by 25 times more the number of physicians. We need doctors, we need nurses, we need medical personnel. You know what we're getting? Bureaucrats in private health insurance companies who are sitting there telling you, you thought you were covered for this procedure, you're not. That's what they're doing. So we're seeing an explosion of bureaucrats when we need people who treat us, who deliver our babies, who take care of us when we are old. Not surprisingly, while health care costs are soaring, and they have been soaring in recent years, so are the profits of the private health insurance companies. From 2003 to 2007, the combined profits of the nation's major health insurance companies increased by 170%. We allowed to talk about that issue? Are we allowed to maybe suggest that there's something wrong when we are the only major country in the industrialized world that has a system dominated by private insurance companies whose function is not to provide health care but to make as much money as possible? And while more and more Americans are losing their jobs and health insurance, I got some good news here. There is some economic growth. The top executives in the healthcare industry are receiving lavish compensation packages. So there's some good news here. And it's not just William McGuire, the former head of the United Health, who several years ago accumulated stock options worth $1.6 billion. Anybody have a problem with one guy in the healthcare industry getting $1.6 billion in stock options? You have, on average, of the top 7 companies, the average is $14.2 million. And that's the insurance companies. The drug companies, their CEOs make even more money. Now, I'm not going to tell you that that is a huge percentage of a $2.5 trillion health care bill, but it does send a message. And the message is the function of health care in our country is not quality, cost-effective health care at all. It is to make money, make money, make money, and the people on top are doing just that. Now, in my view, there is a solution to the crisis that we have. But it requires us to do something that in Congress we don't do all that often. And that is to say to all of the lobbyists who are here and all the big money interests who give us campaign contributions, who lobby so successfully, put those 30-second ads on TV, that your time has come and gone. We're past that now. We can't deal with your hundreds of millions of dollars that you have spent in recent years lobbying Congress and all of your campaign contributions. Enough is enough. Our job is not to represent you. Our job is to represent the American people. And I think when you throw all of that into the hopper, what all of the studies show is there is one way that we can move toward universal, comprehensive, quality health care to all of our people, and that is, in fact, through a single-payer, Medicare for all approach. Private insurance companies don't like it. Drug companies don't like it. Medical equipment suppliers don't like it. That is the way we can go and, in my view, should go. Now, let me conclude, Mr. Chairman, by saying this, putting this whole debate in a different perspective. In my view, the fight for comprehensive, universal, quality, cost-effective health care is, in fact, the civil rights struggle of the moment. And we all know people who, for decade after decade, fought for a nation where all people, regardless of their color, could flourish. We know the struggle that took place for women's rights, for other efforts to make us a more democratic and just society. And I would argue that the fight for a comprehensive, universal, national health care program is that fight this time. And right now, in order to do the right thing, in my view, we're going to have to take on the insurance companies, the drug companies, and all of their money and stand with the American people who want to see a national health care program for all. Thank you very much, Mr. Chairman.
Thank you, Senator, very much.